Hello, my name is Colleen Hughes. I am the Executive Director of the Westmoreland Drug and Alcohol Commission.
And I'm Dr. Mark Fuller, the CEO of Value Behavioral Health. In an effort to combat the alarming drug epidemic in Westmoreland County, we have collaborated with Westmoreland County Behavioral Health and Developmental Services and Southwest Behavioral Health Management to develop an educational video series designed to increase awareness and educate community members.
Hello, my name is Ryan West and I'm a corporate trainer and admissions counselor for Greenbrier Treatment Center. Greenbrier is a wholly owned subsidiary of Washington Health System, offering a full continuum of care for those suffering from chemical dependency issues, from detox and inpatient to partial and intensive outpatient programming. Greenbrier also manages 2 halfway houses for select patients who need a little extra help with their long-term recovery goals. The expense of one accident, one operational error, or one customer service mishap can absolutely devastate a company. And it's estimated that these incident rates increased 3-fold for the substance abusing employee. Employers and their employees simply cannot afford to sit back and do nothing. This video segment focuses on the development and support of a drug-free work environment based on the principles of the Drug-Free Workplace Act of 1988. The Drug-Free Workplace Act is an applied concept built on 5 components: substance abuse policy creation, supervisory substance abuse training, all staff substance abuse education, employee assistance programs, and finally, drug testing. These components are designed to provide a safe workplace for employees and customers and suppress alcohol and drug abuse while supporting the treatment and recovery of substance abusing employees, greatly minimizing the harmful effects that substance abuse has on our workforce. The most recent survey estimates that there are 22.4 million illicit drug users in America. Illicit substances include cocaine, heroin, ecstasy, taking prescription pills that aren't yours, or taking them other than prescribed by your doctor. The list goes on and on. As you'll learn throughout this educational video, or have already learned through personal experiences, the negative behaviors that accompany substance abuse and addiction greatly impact the individual user and their loved ones. Because almost 70% of illicit drug users are employed, that's 15.4 million workers aged 18 years and older. The negative behaviors that coincide with substance abuse affect U.S. businesses as well, costing the American workforce over $80 billion per year. To put 15.4 million working adults into perspective, that is the entire population of Pennsylvania and the city of Chicago, Illinois combined. Even more alarming, this figure doesn't include the estimated 44 million employed binge drinkers and over 12 million employed heavy drinkers. The Substance Abuse and Mental Health Services Administration, or SAMHSA, defines binge drinking as consumption of 5 or more drinks in one sitting, 1 to 4 times per month, and heavy drinking as 5 or more drinks in one sitting, 5 or more times per month. SAMHSA is a governmental agency within the U.S. Department of Health and Human Services, commissioned with the task to reduce the impact substance abuse and mental illness has on America's communities. Every year since 1971, SAMHSA sponsors a massive undertaking whereby professional interviewers randomly visit 65,000 households in America and ask members of the household questions about substance abuse. The data collected from this nationwide survey, called the National Survey on Drug Use and Health, or NSDUH, is extraordinarily accurate and provides SAMHSA with a snapshot into the changing alcohol and drug trends in America each year. This also affords governmental agencies the ability to develop programs to combat growing drug trends, both at the local, state, and national levels. You can be sure that the drug trend statistics and best practices included in this segment are most current and relevant to your employer. So what can a drug-free workplace really do for your business? To answer this question, let's take a closer look at component 1, the development of a sound substance abuse policy. It is best to begin by creating a policy that clearly spells out what drug or substance abuse means, offers first-line prevention tips, and discloses how violations of the policy are handled by the company. It is vitally important to enforce this policy consistently and without bias. Employers who take their drug-free workplace policies seriously and enforce them consistently will see an immediate reduction in employee health care costs, lower rates of absenteeism and tardiness, decreased workers' compensation claims, OSHA recordable incidents well below projected numbers, staff turnover reduction, cutbacks in hiring and training costs, job productivity gains, improvement in quality of work, and elevated company morale, to name a few. If you need one more reason, consider this. Prospective employees who have difficulty adhering to a drug-free workplace policy often seek employment at companies that either don't have one or don't enforce the policy they have. These companies become the target and employer of choice for the illicit drug user and/or heavy drinker, because they can continue to engage in their substance use while collecting a paycheck without fear of retaliation or termination. That being said, some employees develop a substance abuse issue after they're hired by a company. So how is this handled? Well, a truly effective drug-free workplace program is one that supports treatment and recovery versus termination. It can be very costly and time-consuming to replace 5, 10, even 20 years of industry-specific knowledge. It is not only more cost-effective for employers to encourage treatment and recovery, in some cases exceeding a 10-to-1 cost savings ratio, even greater, but in most cases it's simply the right thing to do. And finally, having a sound policy in place is a great place to start. But the policy must also be enforced by management. It is very common for employers to use their substance abuse policy as a fail-safe, a safety net, or a just in case something bad happens. This is a reactive approach that does not support the goals of a drug-free workplace program, which is designed to be proactive. Employers should strive to prevent substance abuse problems from occurring, rather than wait for them to inevitably arise. We don't change the oil in our cars after the engine locks or burns up. We change the oil as scheduled every 3,000 or 5,000 miles as recommended to prevent a problem from occurring. So, if your company already has a policy in place, consider the last time it was updated. Chances are local, state, and/or federal laws have changed enough to make your current policy outdated, even if it's as little as 5 years old. Laws governing substance abuse issues and testing are constantly changing as well. It's vitally important to review your policy annually at a minimum and make any necessary changes to reflect the new laws and/or company policy changes in general. As with many changes to other workplace policies, it is recommended that you consult with a labor and employment attorney before completely implementing your substance abuse policy to ensure full compliance with the law. To get started, the Department of Labor offers a free, online, step-by-step, user-friendly guide to help companies develop or supplement a drug-free workplace policy on their website. For more information, go to www.dol.gov. In the search box located in the upper right-hand corner of the homepage, type Drug-Free Workplace Policy Builder. Shortly after implementing a substance abuse policy, supervisors and management need to be trained on the new or changed policy, which brings us to component number 2, supervisory substance abuse education, or simply supervisory training. Supervisory trainings are typically 2 hours in length and are conducted by a substance abuse professional one time per year, every year. Many times these trainings are offered free of charge by local drug and alcohol treatment providers as part of their community outreach program. Others may charge a reasonable fee. During these trainings, the professional will discuss in detail current drug trends, signs of impairment, and reasonable suspicion documentation and testing. Each year, new illicit drugs are introduced in the United States, reaching our educational systems, our workforce, and American society in general. The current drug trends portion of the supervisory training keeps supervisors and management current with these changes so they are able to readily identify potential signs of impairment that coincide with each respective substance. In a similar vein, supervisors and management need to be comfortable and confident identifying problematic employee behaviors. The reasonable suspicion documentation and testing portion of the training alerts supervisors and management to when, how, and what type of behaviors to document. Greenbrier teaches the acronym SIGN, which stands for See Impairment, Gather Facts, Never Accuse. When approaching a suspected impaired employee, the supervisor or manager should focus on remaining ethical and professional at all times. They must also remember that although they may know the employee very well, the supervisor or manager is a fact gatherer, nothing more. Approach each situation objectively, without bias or prejudice, and never, I repeat, never accuse the employee of anything. There's a big difference between the following statements. John, you were clearly drunk and should have called off today. And John, your eyes appear bloodshot, your speech is slurred, you don't seem to be able to walk in a straight line, and you were 20 minutes late for work this morning. I have reasonable suspicion for impairment. Please come with me. The first scenario was an accusation based on subjective experiences, whereas the second scenario was a statement full of objective facts. Think of it this way. If every supervisor or manager in your workplace encountered that impaired employee, and they were trained on signs of impairment, would each of them report and see the exact same signs that you do? These are objective facts, and they will protect both you, the employee, and the company from unnecessary legal action. Once supervisors and management have been well trained, the employer should offer educational substance abuse sessions and supporting materials to all employees, including frontline staff. Which brings us to component number 3 of the Drug-Free Workplace Act. Similar to the supervisory trainings, these educational trainings should discuss the warning signs of substance abuse and addiction and suggest prevention tips. All employees, regardless of hierarchy, must be able to not only identify problematic behaviors, but also feel safe in reporting them when noticed. Each employee has the responsibility of helping to support a safe and profitable work environment, and the burden of identifying and reporting signs of impairment should not entirely fall on the shoulders of management. It's a good practice for employers to empower and encourage their employees to take a firm stand against substance abuse. To effectively accomplish this, many employers will host an annual drug awareness day for all employees and even their family members. Many will post informational flyers concerning substance abuse in the break room for employees to read at their own leisure. Again, the goal of any drug-free workplace program should be to increase employee knowledge and heighten their awareness of substance abuse. It's quite simple. When employers acknowledge that substance abuse issues exist in their company, employees begin acknowledging and reporting substance abuse issues to their company. An employer that fails to understand this fundamental concept will only achieve some of the benefits of a drug-free workplace program, instead of realizing its full potential. Of the 20.2 million working adults in the United States that have a diagnosable substance abuse or addiction problem requiring treatment, only 4.5% actually acknowledge that a problem exists. That's less than 1 million people out of more than 20 million. When employers wait for the substance abusing employee to come knocking on their door pleading for help, they're going to be waiting a very long time. Sure, there are employees who will ask for help, but employers must first offer substance abuse education so the employee may begin to recognize that a problem exists. They must also feel confident that the employer will embrace their genuine call for help and support their desire to get healthy and recover from their substance abuse issues. As stated previously, the ultimate goal of the employer should be for the substance abuser to get treated and return to work a more healthy, safe, and productive employee. As with supervisory trainings, many local drug and alcohol treatment providers offer all staff substance abuse education trainings free of charge or at minimal cost. There are also human resource consultants or other third-party businesses that specialize in substance abuse and/or training and development who may offer such services. Companies that have employee assistance programs, or EAPs as they're known, can usually receive this training free of charge, along with supervisory trainings, as part of their contract. Which brings us to component number 4, employee assistance programs. EAPs can be a great resource for an employer that offers a variety of morale-boosting amenities, and a complete return on investment is often realized after a few short months. The cost of these programs can range anywhere from $1 to $2 per employee per month, up to $4 to $5 per employee per month, depending on the type of services offered. Concerning the substance abusing employee, the best part of employee assistance program lies in the referral process. EAPs generally handle the substance abusing employee's case from start to finish, keeping HR updated only as necessary for clearance to return to work with a clean bill of health. Many EAPs offer a 24-hour hotline, providing a channel for employees to report possible substance abuse issues or other workplace issues, while allowing the reporting employee the ability to remain completely anonymous if they so choose. Anonymity affords employees a positive outlet to voluntarily disclose private information about themselves or another coworker who they believe has a substance abuse problem without fear of retaliation. EAPs can be an internal department in the company or an outside agency hired by the company to handle such complaints. Insurance companies, major hospitals, even some drug and alcohol treatment providers offer employee assistance programs to local businesses. This brings us to our 5th and final component of the Drug-Free Workplace Act of 1988, drug testing. Employers instituting a drug-free workplace program must maintain a fair, legal, and consistent drug testing program. This program should specify what drugs the company tests for, how they will be conducted, for example, blood, hair, urine, or breath testing for alcohol, and the consequences of a positive drug screen. Testing can include pre-hire, post-incident, reasonable suspicion, random, and even return to work. Although it is recommended that all forms of drug testing are utilized, at a minimum, employers should be conducting pre-employment and post-incident drug testing. As stated previously, prospective employees who abuse substances, including alcohol, seek employment in companies that don't have a substance abuse policy in place or don't enforce the policy they have. If a company doesn't have a substance abuse policy, then in all likelihood, that company doesn't conduct any type of drug testing. By conducting pre-employment drug testing, an employer is effectively accomplishing two objectives. First, it greatly filters out the substance abusing population from gaining employment with your company. Second, pre-employment testing sends a message to prospective employees that drug and alcohol abuse is not tolerated at your company, reducing the probability for hired employees to develop a problem, and increasing the probability that an employee will report their substance abuse before it gets completely out of control. This concludes the 5 components of the Drug-Free Workplace Act. Although not all 5 components need to be followed by every employer in order for the employer to have an effective drug-free workplace, at a minimum, the first 3 components should be implemented along with pre-employment and post-incident drug testing. As a rule of thumb, the more components an employer utilizes, the better. If you're asking yourself, how do I go about getting started, or when is the best time to implement a drug-free workplace policy? You're not alone. Drug and alcohol abuse is a sensitive subject that many employers would prefer to sweep under the rug or turn a blind eye to. But remember, by doing this, you are essentially saying to yourself, I now recognize the dangers of substance abuse and that substance abuse issues exist in my workplace, and I am okay with this. Clearly, this is not okay. The best time to implement a drug-free workplace program is now. If you're having trouble getting started, reach out to your single county authority or local drug and alcohol treatment provider to help get you on the right path. The sooner your company institutes and enforces a sound substance abuse policy and drug-free workplace program, the better. Your employees and your bottom line will welcome the change. Thanks for listening. Be safe, be healthy, and turn this knowledge into action.